Assalamu alaikum. My name is Javed and my group members along with me is Laiba Iqbal, Fatima Kareem and Abidul Rahman. And today the topic of our project presentation is Aplasia. So let's discuss what is Aplasia. Basically the word Aplasia is a Greek word and it would talk about the words A meaning without and the plasia meaning formation. So there is absence of, so basically the word Aplasia refers to the absence of organ in the body. So it can be of any type, like it can be acquired aplasia, or you can say it can be also congenital and aplasia. So if we talk about the acquired aplasia, so it can occur anytime during life stage, like at any age after birth. And if we talk about the congenital aplasia, so it can occur during birth or before birth, you can say. And it can be occurred due to exposure to toxins and other viral infections. So first let's discuss the pathophysiology of aplasia. So basically, the pathophysiology of aplasia can be understood in a greater depth, and if we talk about the cellular systematic and the process of that leading to this condition. So now let's discuss the pathophysiology of aplasia. So basically, to understand the aplasia in a greater depth, we will go through the molecular, cellular, and the systematic process that led to this condition. So the first one is failure of cell proliferation. So basically, in this condition, hematopoietic cell fails to divide. And after this, there is a defective cellular differentiation. So if we talk about this, the cells do not divide properly, and this led to the abnormal function of the cells as well. And it can also be caused by apoptosis and necrosis. So these are the type of cell deaths that led to the aplasia. And if we talk about the hypocellularity, so there is lack of cell development. This led to also abnormal functioning of any organ in the body. And if you talk about the function loss, so there is a loss of function in any type of the cell body, any organ you can say, and it can also lead to aplasia. And if you talk about the inflammation or cytokine, so there is an inflammation or a mutation in the cell that led to the aplasia. So now let's discuss the type of aplasia. The first one is, you can say it's bone marrow aplasia, and it is also called aplastic anemia. So aplastic anemia is basically the failure of bone marrow to produce adequate type of red cells, white cells, and other platelets as well. And we talk about its causes, so it is also caused by the certain chemicals and certain pesticides as well that led to the formation of aplastic anemia. And if we talk about the medication and the treatment of this type of aplasia, so the medication that will be given in this type of aplasia will be antibiotics, and that can be Chloramphenicol, and anti-seizures as well can be given in this condition, and also Carbamazepine as well, and this can also help in the treatment of aplastic anemia. The next type of aplasia will be the limb aplasia. So basically, this is a congenital condition that occurs during birth or before birth, you can say. So in this condition, basically limb fail to form properly during the embryonic development. So as I told before, this is a congenital condition, and the causes that led to the limb aplasia will be the genetic abnormalities. So in this condition, their genes fail to develop properly during the fetus. And the next is the environmental factors, you can say. And environmental factors, if we talk about the environmental factors, there will be the different kind of environmental factors that cause the limb aplasia, that cause the absence of limb in the body. And that factors include the radiation, exposure to the radiation, like high radiation can cause the limb aplasia as well. And teratogens can also cause the environmental abnormalities. And the next is the material infection, and the amniotic band syndrome can also cause the limb aplasia. And if we talk about the medication, so the prosthetic limbs is also can be used as a treatment in the absence of limbs. So prosthetic limbs are basically the type of the artificial limbs that can be inserted in the body, or you can say that can be transplanted in the body. And there will be the surgical intervention, and the physical therapy can also be used as a medication in the limb aplasia. Alright, so thank you so much for listening. So for the next part, I would like to call upon Fatima Kareem, but please come and proceed further. Thank you so much.
So let's start with organ aplasia, in which organs may fail to develop properly. Here are some causes, like it may be congenital, environmental, and the nutritional deficiencies. Here are some medications for the organ aplasia. First one is for kidney. If our kidney is underdeveloped or fail to develop properly, we can administer antihypertensive and diuretics. ACE inhibitors, angiotensin converting enzyme, Enalapril, and the angiotensin receptor blockers, Losartan. If it is more severe case, we can go for the dialysis and kidney transplant for the kidney aplasia. For lungs aplasia, bronchodilators like albuterol and antibiotics like Augmentin can also be administered. For reproductive organs, hormonal replacement, fertility option, and surgical intervention if it is needed. Immunosuppressants is not a first-line drug therapy, but corticosteroids can also be administered in thymic aplasia. Here comes hair follicle aplasia. in which hair follicles are absent or under development, and there is no little growth or little bit growth of the hairs. Genetic syndromes may be the cause. Causes of hair follicle aplasia include genetic syndromes in which genetic makeups are not properly formed, and it includes chromosomal deletion, specific gene mutation, and follicle development. Medications involve minoxidil, spironolactone, and corticosteroids can be administered in hair follicle aplasia. Here are some general symptoms and diagnosis for the aplasia, includes fatigue, pale skin, shortness of breath, recurring infections with frequent infections, poor wound healing, hair loss, or absence of tissues or organs. Diagnosis includes physical examination. Testing includes imaging testing includes CT scan, MRI, ultrasonography, biopsy, tissue culture, genetic testing, immunological testing. Here are some treatments and prophylaxis for the aplasia. Treatment of aplasia includes bone marrow transplantation. If patient has bone marrow aplasia, bone marrow can be transplanted with some other healthy individual. Immunoglobulin replacement therapy in which immune cells can also be administered, and like androgens. Antibiotics, antivirals can also be administered. Hormone replacement therapy if it is a reproductive aplasia. Surgery to correct physical abnormalities if it is in severe case. Prophylaxis includes vaccinations to prevent infections like aplasia, antibiotic prophylaxis to prevent infections, avoidance of exposure to toxins, androgens, testosterone, radiations, genetic counseling to identify the risk factor which type of aplasia is going to occur. Here is the conclusion of aplasia. Aplasia is rare and a complex group of diseases. There is failure of organs or tissues to develop properly. Here includes the bone marrow, thymic, limbic, pelvic, and some other types like hair follicle aplasia. Exact cause is unknown, but genetic mutation, environmental toxins, androgens, and infections may contribute to this aplasia. Early diagnosis and treatment may also help to improving the aplasia. That's all about the